Hello, good morning, and welcome. Welcome, everyone, to this live telephone town hall meeting. I see we do have a few folks on the line with us right now. Thank you so much for joining us here early. Please go ahead and just stay right on the line as we will get started in just a few moments. We are here to invite you to join Congressman Ted Lieu, representing the 33rd District of California, for this very special telephone town hall meeting. This call is an opportunity for residents to ask questions, to share their concerns, and also to get updates on the latest from Congress. So if you have any questions during the call, please go ahead. Do not hesitate. Press 0 on the keypad on your phone. You can do that now or at any time throughout the forum. Again, simply by pressing 0 on your phone keypad to submit those. If you would rather have me, the moderator, read your question over the air, that's totally fine. Go ahead and let your operator know that that is what you would prefer. Also, we're always trying to expand our email list. So if you would please go ahead and press 7 to provide us with your email, you will be able to receive the latest from the Congressman's office. And I'll go through this intro just one more time here as we allow more and more of your neighbors to join our call. So for those just answering the phone, hello, good morning, and welcome. You are here to join Congressman Ted Lieu for this very special telephone town hall meeting. This call is an opportunity for residents to ask questions, share their concerns, and also to get updates on the latest from Congress. So during this call, please, we encourage you to press 0 to connect with an operator to ask your question. If you don't feel comfortable going live, just let your operator know, and I will be more than happy to read your question over the air. So whatever is most comfortable for you is most comfortable for us. So either way, pressing 0 now to submit those. Also, you can press 7 if you would like to provide us with your email to receive the latest from the Congressman's office. So with that, I would like to officially get this call started off by turning it right over to your Congressman. Ted, please take it away.
Okay. Thank you so much. Again, I'm Congressman Ted Lieu, and I want to welcome everyone to this telephone town hall. We're going to discuss benefits that you can receive under the American Rescue Plan, including the child tax credit, as well as the updated CDC guidance on the pandemic, and also what is in store for us with the economy. And I'm so pleased you're able to join us. As you may know, Congress passed the American Rescue Plan, and that plan was designed to get America on the road to recovery. It was designed to get shots in their arms, people back into jobs, kids into school, and cash into pockets. And one of the benefits under the American Rescue Plan is the child tax credit. It's very important that you file your taxes, because if you don't do that, then you won't qualify for the child tax credit. Under the child tax credit, if you're a household with a child that is under 6 years old, you will get a $3,600 credit. If you have children who are between 6 and under 18, then you'll get a $3,000 per child credit. And this is a benefit that you can only get, again, if you file your taxes. And the tax filing deadline for this year is this coming Monday. The IRS had moved it to May 17th. I also note that we ran some numbers on the child tax credit, and it has significant benefits for our congressional district. Over 50% of children in our district will gain from this expanded child tax credit. That's over 74,000 children. And of that amount, over 4,000 children in our district will be lifted out of poverty. So this is, again, a very important benefit of the American Rescue Plan, and encourage that you file your taxes in order to qualify for it. You may have also seen that the CDC recently updated guidance on activities you can participate in if you haven't fully vaccinated, as well as the fact that you don't have to wear a mask in most situations if you're fully vaccinated. And we have with us an expert speaker that many of you have heard from before, who has appeared in our prior town halls, and it's Dr. Shai Roy. Dr. Roy is a cardiologist and assistant professor of medicine at Harvard UCLA. Dr. Roy also serves as Director of the Inpatient Cardiac CT Program and Associate Cardiology Fellowship Program Director. Dr. Roy is the immediate past president of the LA County Medical Association and is also an elected trustee at Santa Monica College. Joining us today, we also have a second expert speaker, and that is Professor Jerry Nicholsberg. Professor Nicholsberg joined the UCLA Anderson School of Management and the UCLA Anderson Forecast in 2006. Since 2017, Professor Nicholsberg has served as faculty director of the Forecast. He earned his PhD in economics from the University of Minnesota, specializing in monetary economics and econometrics. So we look forward to hearing from both Dr. Roy and Professor Nicholsberg. And again, thank you so much for joining this telephone town hall. And why don't I turn over now to Dr. Roy, who will make some opening remarks, followed by Professor Nicholsberg, who will make some opening remarks, and then we'll answer any questions that you may have.
Thank you, Congressman Lieu, and welcome to the listeners. Thank you, Congressman Lieu, for your leadership throughout this pandemic and keeping your constituents apprised of everything going on from Washington. I'll start with a vaccination update. The vaccination for COVID-19 is available to those that are 12 years or older in LA County currently. So again, 12 years or older. Teenage children have been added to the eligibility mix recently, and so that's available in LA County and throughout the country. The total doses administered in LA County have been more than 8 million, and more than 43% of Angelenos are fully vaccinated, and that includes almost 70% of seniors. And then if you look at folks who have just received at least one vaccination, that's almost 60% of the total population in LA County and 83% of seniors. And so we're making remarkable progress. The vaccinations so far seem to be effective against variants within the United States. And so a lot of concern about whether these vaccinations will be effective as the virus inevitably mutates and there's variants out there, and all of the preliminary data shows that the vaccinations that are out there have effectiveness against the variants that are here in the United States. Additionally, the situation in India is the worst in the world. The very preliminary data is promising that the vaccination may be effective even against the really difficult Indian variant. So that's all good early news in terms of the vaccination and the variants. The data continues to suggest also that the vaccine mitigates transmission as well. So not only do the vaccinations protect you as an individual from COVID-19, but also mitigate your ability to transmit it to other folks who may not be vaccinated. So based on this data, the CDC updated their guidelines earlier this week and have said that those with vaccinations can largely resume life as normal pre-pandemic without masks, both in outdoor and indoor settings. But the CDC was careful not to supersede local authorities. And so in California, we continue to have an outdoor and an indoor mask mandate. The outdoor mask mandate is likely to be lifted on June 15th if things continue to trend positively. And my expectation is that they will continue to trend positively. And then, hopefully further later in the summer, in terms of the indoor mask mandate as we get closer to achieving herd immunity. And I think many of us expect that herd immunity will be achieved in LA County and California and many parts of the United States later in the summer. And as we enter, just like last March, we entered into a mask-filled world, which was a shock to our collective systems. I think that exiting that mask-filled world will likely be gradual and will depend, not just on CDC or state guidance, but also on everyone's comfort regarding the risks. And so I would just encourage everyone as we sort of emerge from the pandemic and emerge from many of the things that we've done during the pandemic to protect ourselves, our families, and our neighbors, to be respectful for each other as people will, will certainly have different levels of comfort as we, emerge back to some semblance of normalcy in terms of what we thought about pre-pandemic. With that, thank you again, Congressman, for welcoming me to this town hall, and look forward to any questions that come up.
Yeah, well, thank you so much, Congressman, and thank you both, Dr. Roy and Professor Nicholsberg, for being with us here to update our listeners and also to help answer questions. So before we go ahead and take our first question, a quick reminder, if you haven't done so already, or are maybe just thinking of a question now, go ahead and submit those by pressing 0 on your phone to get those in line. And also, don't forget, you can still press 7. You can do that now or at any time if you would like to provide us with your email to receive the latest from the Congressman's office. So with that, I'd like to go ahead and welcome our first caller.
Actually, why don't we first have Professor Nicholsberg make an opening presentation?
Oh, okay.
You got it. Go ahead, Professor.
So thank you, Congressman Lieu, for inviting me to this town hall. I'd like to make just a couple of comments before we go to the questions. I'm sure the questions are pressing, but the first is that this is a very unique situation. We have a recession that was induced by a pandemic. We haven't seen that in 100 years. And there's a lot of noise out there. There's a lot of extrapolation from single data points based on people's individual views of what should be rather than what is. And just as an example, I think if we asked everyone on this call or the man in the street, the woman in the street in California, how is California doing relative to other states like Texas and Florida? The answer would be California is doing very poorly, but in fact the data says that California is doing better than those two states and most other states in the U.S., better with health outcomes and better with economic outcomes in 2020, and that's our expectation. The second thing that I'd like to say before we get to the questions is there is the characterization of the packages that have been coming out of Washington as stimulus packages, but really they're support packages. And they do two things. One is they prevent people from becoming homeless because this recession has disproportionately affected the lower income households in California. And so that's important for our future economic health. And secondly, they keep people close to their former employment, and that makes it much easier for them to be reemployed. So these packages, these support packages, are really kind of unique in bringing us to a point where we can move much more rapidly back to a prosperity than in the past couple of recessions. And with that, happy to take any questions.
All righty. Yeah, thank you. Didn't mean to get in front of you there. Looks like our first question here is coming from Terry Jones in LA. Terry, you are live on the line. Please go ahead with your question.
Hi, Congressman Lieu. I just want to thank you for all you have done. And also, I was one of the first people on those calls that you had back in March a year ago when all this happened. And I want to know how you feel about California now doing so well that we may be able to loosen our mask mandate in June.
So I'll answer that question first and then have Dr. Roy also comment on it. I think it's very good news that we're projected to hit herd immunity sometime in the summer. That's going to require the cooperation of everyone involved to get as many people vaccinated as possible, but it is a very welcome change. It tells me that we're going to get back to normal much sooner rather than later. And I'm just thrilled that we have an administration in D.C. That is very focused on making sure that people get vaccinated. And as many of you know, not only did President Biden get vaccinated, unlike a former president, he did not hide the fact that he got vaccinated. Instead, the Biden administration is promoting these vaccines, and that's really, I think, the way to get us out of this pandemic. And there, in terms of the specific mask guidance, Dr. Roy, do you want to comment on that?
Sure, I absolutely agree with the caller and the congressman. Things are really looking very positive now here in California, here in Los Angeles, especially not just since last March, but since the terrible surge that we went through in LA County from November until February. And so it's really nice to be talking about something so optimistically. In terms of the mask guidance, I think we will achieve herd immunity by the end of the summer, and we'll emerge. It'll make a difference for schools. It'll make a difference, obviously, out in the public. And in my opinion, is we may be even underestimating when we achieve herd immunity, because we're really primarily basing it on vaccination numbers. But a large number of Los Angelenos have contracted COVID within the last year and have likely developed antibodies to varying degrees to COVID, and we likely underestimate that effect. And so I think that we are on the cusp of herd immunity in a couple of months, and then look forward to being in a mask, a lesser mask environment. One thing I will just caution is we've seen this in Asia that they've had prior experience with pandemics, and masking in certain situations that are considered high risk. For example, going out into public markets, flying on airplanes, that has become commonplace in the last 20 years in Asia, based on their experience with SARS and MERS. And I think that you will see that in the United States as well. In areas where there's large amounts of people in public, I think you will see folks, based on their own personal comfort level, wear masks. And I think that should be, something that is accepted in our society.
Thanks so much for that question, Terry. So glad we got you connected, and thank you for joining the conversation. Our next question is going to be coming from Judy. Judy, you are live on the line. Please go ahead with your question.
Hello. Firstly, Congressman Lieu, as an LAUSD retired teacher, I want to thank you for your support of teachers and especially your support of the WEP GPO Social Security Act that we're trying so hard to overturn. Thank you. My question is regarding our reassurance, those of us that have been vaccinated, that this honor system that they're talking about will really protect us. Even in my own immediate family, for non-political reasons, I know the vaccine has become a political hot issue. We have one family member that chooses not to become vaccinated. What security do we have, or reassurance, that as we're going into larger public venues, that people that are choosing not to wear a mask are doing so because they're vaccinated? Thank you.
So I'll try to answer that question and then see if Dr. Roy has any comments. At some level, you can't actually have that assurance. So if you're just generally outside, people certainly can lie about whether they're vaccinated or not. Now, when you're dealing with like specific businesses, each business has the authority to decide for themselves how they want to run that business. So, for example, if you're an airline, you can require that people be vaccinated before, they get on your plane. Or if you're, for example, a private college, you can require that all students be vaccinated before they go back to school. Now, if it's a government, I think that might just depend on a case-by-case basis, depending on the specific governmental entity. I would assume, for example, that public hospitals probably have some pretty stringent requirements for who should be vaccinated before they can, care for patients. So it's going to be on a case-by-case basis. But in general, you're either going to have to trust someone if they say they're vaccinated, but there's really no other way to do that since we are a free and open society. And I don't know if Dr. Roy, if you have any other insights on this.
Sure, and that's a great question. And I would say that that's where the herd immunity becomes key. I think that the number one marker for trust that, COVID is really going to dissipate is just looking at the larger numbers in terms of percentages of, our Angelenos who are vaccinated. And, as we achieve that herd immunity and you go into public, you can have that confidence. And so your point is well taken. Individuals, in our free society, as the Congressman mentioned, it's very unlikely that we're going to ever really be able to know as we go into public and over the next couple of months who is vaccinated or not vaccinated. But looking at the larger percentages, achieving herd immunity, I think those are things that will give us confidence. And then, I do want to reiterate, in California, we do still have a mask mandate from the governor that at least will run through until June 15th for both outdoor and indoor mask usage, and that's in line with the CDC mandate, because the CDC directive from earlier this week does defer to local authorities in terms of mask wearing guides.
All right. Thank you so much, Judy, for joining the conversation. Our next question is coming in from Maria, and she would rather not go live. This question is for you, Professor Nicholsberg. So Maria is asking, talking to my friends, it feels like we all have a different perspective on our jobs and how much they dictate our lives. I'm hoping we'll come out of this with more work-life balance. How do you think the pandemic has changed our workforce, especially for parents with young kids?
So that's a really interesting question. What the pandemic has done is it's accelerated the adoption of technology. And so both on the part of companies and on the part of individuals as we've been working from home. And that means that employers can, without sacrificing productivity, create a work environment which is much more flexible, and that certainly can contribute to work-life balance in a big way. So look for that to occur in the future. Kind of the flip side of that, though, is that the adoption of technology is going to make some of the jobs that were lost, particularly at the low end of the income scale, obsolete. And so we do have a workforce development issue, which is a big policy issue here in California. However, moving those folks into employment, which is more technologically oriented, will also give them the opportunity to have more flexible work schedules and a better work-life balance.
Thank you so much, Professor. And while we have you, I do have another question here for you. This question is coming from Jack, who also would rather not go live. Jack is asking, while the isolation of quarantine has been difficult, I have enjoyed the flexibility that working from home allows, especially having no commute in LA traffic. Even as things open up again, do you think more employers will allow for flexible work schedules moving forward?
I have to say we all were happy not to be in LA traffic, but I was in a traffic jam the other day, and it was very nostalgic. We're going back to the office. I think the evidence is really clear that continued work from home results in, on average, declining productivity, but we will have more flexible work schedules. So, for example, Fridays might be work at home day, and we'll be in the office 4 days instead of 5, or 3 days instead of 5. So we will be able to avoid some of that commute. But it's becoming increasingly clear that companies want us back in the office. We want to be back in the office. That's where creativity and productivity and the dynamism of the California economy comes from.
Could I just follow up on that real quick, Professor Nicholsberg? I can understand that for sort of the day-to-day activities, but what about sort of meetings in the past where you had to, let's say at a company that had folks from all over the country and just fly them into one location? Do you think you're going to have a lot more meetings now that are done by Zoom or other means, and there's going to be less traveling of people going to one location for those meetings?
There will be some of that, and it depends on what is to be accomplished at the meeting. If the meeting is, for example, to put together a proposal for a business project, no, I think people have to be together. That's where the creativity that goes into the proposal comes from. If the meeting is simply a weekly update, then sure. But also, I think we should keep in mind that some of the meetings, such as training, are also thought of on the part of employees as an employment perk. So they will go to another city, they'll get to know in person some of the people they talk to on the phone and email with, and they get out of the office for a week for training. So yes, we're going to do more remote meetings, but not as much as I think is being forecast.
Great. And actually, let me just also ask one more question that's very important to my district, and I know Southern California. So with every passing day, we know that space becomes more important, both commercial space as well as space for national security. And I'm very pleased that the United States Space Force has located Space Systems Command at Los Angeles Air Force Base. That's going to start later this year. I had lobbied for that to happen along with Congressman Ken Calvert. We're both co-chairs of the California Aerospace Caucus. And just want to get your view of whether you think space is going to be a growth industry for Southern California, and what your view is of how important space is for our country and our state.
So let me take the first question. Is this going to be a growth industry for Los Angeles, and especially West Los Angeles? The answer is emphatically yes. This is where the ecosystem is. It is where the engineers are, and if one polls people around the country in the aerospace industry, and I spent, in addition to my academic career, a long career in aerospace, you find that they say all the innovation, not all, but the innovation and the dynamism in the aerospace industry, particularly with respect to space, is in Los Angeles. And that's where people want to be. That's where the startup companies are. How important is that to the U.S.? Well, space has some very difficult engineering problems to be solved, and that creates innovations, that creates new technologies, and it's that technological development that really spurs more rapid economic growth. So it's generally important, and specifically to our area here in Los Angeles and West Los Angeles, it's going to be a very important part of growth over the next decade.
Great. Thank you so much, Professor Nicholsberg.
Yes, thank you all. Great conversation. And it looks like we have time to take a quick poll question here. So everyone on the line listening, go ahead and get those keypads out and ready to vote. Our first poll question goes like this. Are you taking advantage of the child tax credit that was included as a part of the American Rescue Plan? So you can go ahead and use the keypad on your phone to vote, pressing 1 here for yes, press 2 for no, or press 3 if you do not qualify. So again, voting right now, are you taking advantage of the child tax credit that was included as a part of the American Rescue Plan? So pressing 1 for yes, press 2 for no, or press 3 if you do not qualify. And while you have those keypads out, I want to also remind everyone still listening that you still have that opportunity to press 0 to get in line with your question. Please take advantage. We'd love to hear from you and get your questions answered. Also, you can press 7 now or at any time if you would like to provide us with your email to receive the latest from the Congressman's office. So you'll get those updates via email. So with that, going to get right back to our live caller questions here. We have our next question coming in from Barbara. Barbara, welcome to the call. Go ahead with your question for Dr. Roy.
Okay. First of all, I'd like to say to Congressman Lieu, thank you for having this town hall. It's been very informative. I'm on the council in RPV, and I am anxious to share what I've learned here. But my question for the doctor is, I have two grandchildren at home living with me, 12 and 17. The 17-year-old had a bout of COVID, very, very mild, in February. And I want to know how vital it is for them to get the vaccine. Does he have antibodies? Should he have one shot or two? In general, how important is it for the 12-year-old?
That's a great question. So, children, as we've seen from the data over the last last year and a half or so, children are low risk to have moderate or severe, reactions to COVID compared to other high-risk groups. And so that's without the vaccination. I think that, in terms of prior having COVID, the advisory right now is that still to get the vaccine. And we don't antibody test beforehand. The advisory would be, 3 months later to go ahead and go get the vaccine. It's kind of a data-free zone. We don't have a lot of data on, people who have gotten COVID that are antibody positive and then get the vaccine. Mostly because the antibody data it has not been a huge focus, and so most of the focus has been on vaccination. And so the current guidance would be to go get the vaccination. It is safe to get the vaccination, even if you've had COVID, in the remote past. And if you do have antibodies within your system, it is still safe. And then finally, the biggest question is, should children get the vaccination? It does protect them. It does protect the spread as students go to, as kids go back to school. They do interact with family members who are older, maybe higher risk, who may or may not have gotten the vaccination. And so, those are all the considerations. I would encourage, my own son is too young. He's 3 years old. But if I had school-age children at, 12 and 17, I would encourage you to strongly consider getting the vaccine for them.
Thanks so much, Dr. Roy. Barbara, so glad we got you connected. Our next question here is for you, Congressman. This question's coming from Anna, who would also rather not go live. Anna's asking you, it feels like we're finally getting to the other side of this awful pandemic. I'm still worried about overspending when it comes to the federal budget. Why is now the right time to invest in things like infrastructure?
Thank you, Anna, for that question. So let me answer this in two ways. We currently have a large infrastructure deficit, according to the American Society of Civil Engineers. It's over $4 trillion in terms of roads, highways, and bridges that we need to fix. President Biden has proposed the American Jobs Plan, of which infrastructure is a component, and there's going to be between $700 and $800 billion targeted at infrastructure from the federal government. That money then gets leveraged by state and local governments that often will do matching funds, and so it's going to be more than that in terms of fixing our roads, highways, and bridges. And the American Jobs Plan is going to be paid for, and it's being paid for by an increase on corporate tax rates. There have been multiple studies showing that there are a large number of very large corporations that basically pay no taxes. So we've got to close tax loopholes. And also, their increase in corporate tax rates is still less than what these corporations were paying even just 4 years ago. So it sort of is a way to pay for infrastructure, but also it's fair to these corporations. So that is what is being proposed, and that won't actually add to the deficit because, again, this is a infrastructure program that is going to be paid for.
Thank you so much, Congressman. We have another caller here. This is Rich in Malibu. I'm going to read his question as well over the air. Rich is asking, I am very proud of Congressman Lieu and what he has done. What is the latest medical information about vaccinating pregnant women? And that question's coming from Rich, Congressman.
So I am not a doctor. I have no idea, but we got a doctor with us today. So, Dr. Roy, would you like to answer that question?
Sure. So that's an excellent question that certainly comes up. The American College of Obstetricians and Gynecologists recommends that pregnant women do get vaccinated, as it does protect themselves from COVID, and then it prevents transmission of COVID to the fetus. There is no long-term data, as you can imagine, on pregnant women and then on children, but there is no reason to think that the vaccination affects the DNA for the fetus or anything like that. It's simply something that elicits an immune response in a woman. We do know for sure that if a pregnant woman gets COVID, that she is higher risk and then has the ability to transmit it to a fetus. And so the disease itself certainly puts both the mother and child at risk for COVID, whereas the vaccine, will prevent getting COVID and transmitting COVID. And so again, ACOG, the American College of Obstetricians and Gynecology, strongly encourage women who are pregnant to get the vaccine, because any theoretical risk certainly is much lower than the benefit.
And actually, Dr. Roy, that sort of brings up an issue. I know some people are vaccine hesitant with regard to these COVID vaccines. So let me just ask you sort of some questions that maybe can allay some fears. And the first is, it's true, right, that you can't get COVID from getting this vaccine?
That's correct, Congressman. You cannot get COVID from the vaccine. It's not a live vaccine. The way these vaccines work are essentially they mimic, regardless of how it was made, Pfizer and Moderna, which are mRNA vaccines, or Johnson & Johnson, and which is a more conventional made vaccine. They're not live, and then basically they just show your immune system a protein that is similar to the protein on the COVID virus, and so it teaches your immune system to recognize COVID and stamp it out before it becomes a problem. And so it's not a live virus that's injected into your system.
And for the Moderna and Pfizer vaccines, they don't actually stay in your body. They disappear after a while, right?
Correct. Basically for, these, basically it's something that is, injected into your muscles, dissipates into your body for a short period of time, teaches your immune system, hey, this is a protein that you want to keep track of. And so and then your immune system learns that, is prepared for that next time it comes into contact with that protein. But the actual, vaccination, is, somehow metabolized by the body. It's not something that lingers necessarily.
And all of these vaccines, including J&J, are extremely efficacious at preventing hospitalizations and deaths from COVID, correct?
Correct. All three of the available vaccines are very efficacious at preventing moderate and severe COVID symptoms, including hospitalization and death.
Okay, great. Thank you.
Thank you both, and thank you, Rich, so much for that question. Next up, we have a question coming from Fran, but I do just want to remind everyone on the line, it's still not too late. Go ahead and press 7 to provide us with your email so that you can be able to receive the latest from Congressman Lieu's office. So pressing 7 now. This is just a last reminder here. Go ahead and take advantage of that option. Looks like we have Fran here, and she would rather not go live. Fran is asking, she filed taxes for 2020. She made under $30,000. She heard that there is a rebate of $1,200 for anyone making less than that. Is this true? Congressman?
So first of all, contact our office or we will reach out to you specifically on your case. There is the earned income tax credit. And again, you've got to file your taxes in order to claim it. But for a lot of folks, that is a significant benefit that they can receive. And it does sort of vary depending on your exact income. But the earned income tax credit is money that you can get back from the federal government, especially if you had very low income. And so without sort of knowing exactly sort of all the specifics of your tax situation, I think it's better to contact our office or we'll have a caseworker follow up with you. But in general, people who have low income should file their taxes and claim the earned income tax credit.
Great. Thank you so much, Congressman. And Fran, thank you so much. Glad we were able to answer your question here. It is time for our final instant poll today. So go ahead, get those keypads out and ready one last time here. We want to know, do you support the American Jobs Plan, which will help millions of American workers and fix America's crumbling infrastructure? So go ahead, pressing 1 for yes or 2 for no. So again, just voting right now. Really want to get everyone's feedback on this. Do you support the American Jobs Plan, which will help millions of American workers and fix America's crumbling infrastructure? So go ahead, press 1 on your phone keypad for yes, or you can press 2 for no. And thank you all for weighing in on those poll questions here for us today. Our next question is coming from Ahmed, who would also rather not go live. Ahmed is asking, why is it necessary to increase unemployment compared to ordinary time, and what are you doing to get people back to work? Is there any move to make income tax deductible again? And he also wants to thank you, Congressman Lieu. He says you are the best.
Oh, that's very kind of you. So under the American Rescue Plan, unemployment benefits were extended to September. And as all of you may know, this plan was done earlier this year, and people actually weren't projecting their incredible success of the vaccination rollout and distribution. And because it's been so successful, it does appear we're going to get to normal much sooner rather than later. And so as a result, we see the economy starting to pick up. We see businesses opening. By the way, that reminds me, under the American Rescue Plan, there's also provisions for restaurants to apply for grants, as well as shuttered venues to apply for grants. So there are a whole host of provisions, again, for businesses as well as individuals and families to access. But the unemployment does go to September, and that's because there are still a number of industries that have not fully opened up. There are still people who are unemployed, and we had massive job loss during this pandemic that we're still trying to recover from, and that's why it's important to have these unemployment benefits extend for a few more months. I don't imagine that will be renewed after September, but I do think right now, while we're still getting out of this economic recession, that's important that we still have these unemployment benefits for those who have not been able to get their jobs back.
Thank you so much, Ahmed, for your question and those kind words. It does look like we have reached our allotted time today, and we did answer as many questions as we could. For those who still had any questions, comments, or concerns, we'd like to just invite you to stay on until the very end of the call to leave us a voicemail message. So simply follow the prompts there. In doing so, we do ask that you leave your name and your best contact so that we have a fighting chance of reaching back out to you. and we do sincerely appreciate your time. So with that, Congressman Lieu, if you would please bring us to the finish line.
Great. I'm going to have Dr. Roy give some closing comments. Before that, I do want to note that our district office remains open to assist constituents. All my staff are working remotely, but their productivity has been fantastic. And so if you have an issue with a federal agency, or if you're not getting your Social Security check or any other issue with the federal government, please contact our district office and we will assist you. So let me turn over now for some closing comments from Dr. Roy, and then I'll come back.
Thank you, Congressman, again, for your leadership, and thanks to everybody who participated in the town hall. I just want to close by encouraging everybody to keep pushing the envelope here in LA County and get vaccinated. The vaccination is open for anybody 12 years and up, and so I encourage all of you, if you haven't been vaccinated, to get vaccinated, and if you've gotten your first dose, to make sure go ahead and get your second dose, if it's Moderna or Pfizer, so that we can achieve a level of herd immunity later this summer, and we can really move forward from the pandemic. And then secondly, when you have been vaccinated, please, I would encourage you to be open and honest about it. Talk to your friends and family and neighbors about your experience getting the vaccine. I think that's really helpful with folks who, have some hesitancy in getting the vaccination. And so I just encourage you to be leaders in your community and be open about getting the vaccine. So thank you again, Congressman, for allowing me this opportunity.
Thank you so much, Dr. Roy, for your expertise and terrific advice. And let me just follow up a little bit on what Dr. Roy said. The reason that achieving herd immunity is so important is what that means is the virus can no longer spread and then it dies, which means we literally will not have this virus around us. And so if we can achieve herd immunity, that will be a fantastic situation, because then you can do everything that you would have done pre-pandemic. And that is our goal. And with the vaccine rollout and distribution being so effective, I think we're going to hit that goal sometime this summer. And right now, at many of the vaccine locations, you don't even have to make an appointment. You can just walk in and get the vaccine. So I encourage you or your loved ones, your friends, to do that if that hasn't yet happened. And I know if we all work together, we're going to be able to make California and America an even better place to live, work, and play. So thank you so much for joining this telephone town hall, and so honored I'm able to represent you and our congressional district. And please have a wonderful weekend.